Every year, thousands of men in their 50s, 60s, 70s, and even 80s live with undiagnosed prostate cancer. The disease may silently progress without noticeable symptoms, often until it's too late. Prostate cancer, which affects 1 in 8 men, becomes a growing concern as men age. But did you know that by recognizing certain early symptoms, you could make a crucial difference in your survival? Early detection makes all the difference, and understanding these subtle signs could save your life. According to the American Cancer Society, over 288,000 new cases of prostate cancer will be diagnosed this year. Even more sobering is that approximately 34,700 men will lose their lives to this disease. But here's the most important part. When caught early, the survival rate for prostate cancer is an incredible 98%. Sadly, many men dismiss these early warning signs, assuming that they are just part of aging. However, it's crucial to understand that age alone doesn't determine your risk. Family history, lifestyle, diet, and even ethnicity all play significant roles in your likelihood of developing prostate cancer. In this article, we'll break down 8 important symptoms every man aged 55 to 85 should be aware of. No matter your age or general health, these signs could be your body's way of signaling that something isn't right. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. Number 1. Frequent urination and nocturia, nighttime urination. If you notice an increase in your trips to the bathroom, especially at night, this could be a concerning symptom. While frequent urination is often brushed off as a normal part of aging, it can be an early warning sign of prostate issues, including prostate cancer. When prostate cancer begins to develop, it can affect the size, structure, and function of the prostate gland. This growth can cause pressure on the urethra, disrupting the normal flow of urine, which results in more frequent bathroom visits. Under normal circumstances, most men can go about 3 to 4 hours between bathroom breaks during the day without feeling the need to urinate urgently. However, with prostate cancer or other prostate-related conditions, these intervals can shrink, causing an increase in both daytime and nighttime urination. Nocturia, or waking up multiple times at night to urinate, is a particularly bothersome symptom that can severely impact sleep quality. Most adults can sleep for 6 to 8 hours without interruption, but when prostate issues are present, this natural sleep cycle can be disturbed. The need to get up and use the bathroom can interrupt your rest, leaving you awake multiple times throughout the night. This disruption not only affects your sleep but can also contribute to feelings of fatigue and irritability the following day. If you find yourself waking up more frequently than usual or having trouble sleeping through the night, it is important to take note of this symptom. While occasional nighttime urination might seem harmless, a consistent pattern should be taken seriously. If this becomes a regular issue, it could be an early warning sign that requires further evaluation by a healthcare provider. Prostate issues, including prostate cancer, are treatable when detected early, and seeking medical attention promptly can help address the root cause of the problem, improving your quality of life and overall health. Number 2. Painful ejaculation. Prostate health plays a crucial role in overall sexual function, and any changes in how your body responds sexually can be a red flag. One such warning sign is painful ejaculation. While it might seem like a minor or occasional issue, painful ejaculation can indicate more serious health concerns, particularly related to the prostate. This discomfort isn't something to brush off. It could be an early indicator of prostate conditions, including prostate cancer. The pain associated with ejaculation can vary greatly in intensity, type, and duration. Some men experience a sharp, stabbing sensation at the tip of the penis, while others feel a throbbing or aching in the testicles, making it difficult to focus or enjoy intimacy. For some, the discomfort may extend to the rectum or lower abdomen, creating a deep, lingering ache that feels like it comes from within. In other cases, the pain is fleeting and lasts only a few seconds, while for others, it may persist, affecting their overall sexual experience and even day-to-day activities. It's important to note that while some men may only feel mild discomfort, others can experience excruciating pain that not only disrupts their intimate life but also leads to anxiety and emotional distress. The pain can interfere with sexual activity, reducing libido, and impacting relationships. In some instances, It may even cause men to avoid sexual intimacy altogether due to the fear of experiencing pain during ejaculation. Although it's easy to overlook such symptoms as temporary or harmless, ongoing or recurring pain during ejaculation should never be ignored. The prostate, located just below the bladder, can be affected by a range of issues that may be contributing to this discomfort. These include prostatitis, inflammation of the prostate, benign prostatic hyperplasia, BPH, or more serious conditions such as prostate cancer. In some cases, painful ejaculation can also be linked to infections in the prostate or urinary tract, which may require medical treatment. If you are experiencing painful ejaculation, it is essential to seek medical advice. A healthcare professional can conduct a thorough examination, including a digital rectal exam, DRE, or blood tests such as a prostate-specific antigen, PSA, test, to assess the health of your prostate. Early detection of any potential issues, especially prostate cancer, significantly increases the chances of successful treatment and recovery. Taking action early, rather than ignoring the symptoms or hoping they will resolve on their own, can help safeguard your long-term health and preserve your quality of life. Don't hesitate to speak with your doctor about any discomfort you're experiencing during ejaculation. Your prostate health is too important to ignore, and addressing issues promptly can help prevent more serious complications down the line. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 3. Blood in urine or semen. The presence of blood in the urine, hematuria, or semen, hematospermia, is a symptom that should never be overlooked. Whether the blood is visible to the naked eye or detected through a test, it is always considered a significant warning sign that requires immediate medical attention. While there are some relatively minor causes of bleeding, such as infections, inflammation, or kidney stones, blood in these fluids can also be indicative of much more serious conditions, including prostate cancer. When prostate cancer is present, a growing tumor can put pressure on the surrounding tissues, including blood vessels. This pressure can cause small tears or more severe damage to the blood vessels, leading to blood leaking into the urine or semen. Even if the blood appears in small amounts or only intermittently, it should still be taken seriously. In some cases, this bleeding may not cause any pain, which can be misleading and potentially allow the issue to go undiagnosed until it has progressed further. Blood in the urine or semen can also be associated with other prostate conditions, such as benign prostatic hyperplasia, BPH, a non-cancerous enlargement of the prostate, or prostate infections. However, because prostate cancer is one of the leading causes of these symptoms, a healthcare provider must be consulted promptly for further evaluation and diagnosis. An early diagnosis and intervention are vital in managing any prostate-related condition, particularly prostate cancer. When caught early, the chances for successful treatment and positive outcomes are significantly higher. Additionally, a doctor may order tests such as a urine analysis, blood tests, a prostate-specific antigen, PSA, test, or even imaging studies to understand the underlying cause of the bleeding. Ignoring or delaying medical attention for these symptoms can lead to further complications, including the spread of cancer to other parts of the body or the development of additional health issues that may complicate treatment. Therefore, if you experience any signs of blood in the urine or semen, it is essential to schedule a doctor's appointment as soon as possible to ensure appropriate care and timely intervention. Number 4. Pain while sitting. Sitting is a basic, everyday activity that most people don't think twice about. However, if you begin to feel pain while seated, it can be a warning sign that something might be wrong with your health. One possible cause of such discomfort is prostate issues, specifically prostate enlargement, which can put pressure on surrounding areas and lead to discomfort in various parts of your body. The prostate is located near the bladder and the rectum, and as it enlarges, it can exert pressure on nerves and tissues in the pelvic region, lower back, and hips, which are all interconnected. The nature of the pain can vary significantly, ranging from a subtle, nagging ache to sharp, stabbing sensations that can catch you off guard. Some individuals may experience a constant dull ache that lingers, while others may find that the pain fluctuates in intensity, sometimes becoming more acute with certain movements or positions. This discomfort is often most noticeable when sitting for extended periods, such as during long drives, while working at a desk, or while watching television. The longer you remain seated, the more intense the pain might become, especially in the lower back or pelvis, which are common areas affected by prostate issues. While discomfort while sitting is not always indicative of prostate cancer, it is a symptom that should not be ignored. In some cases, persistent or worsening pain may point to a more serious condition, including prostate cancer. If the pain continues or becomes more severe over time, it is important to seek medical advice. Your doctor will be able to assess your symptoms, potentially perform diagnostic tests, and help determine the underlying cause of the pain. Early detection and treatment of prostate issues, including cancer, are crucial for improving outcomes and preserving quality of life. Paying attention to when and where the pain occurs, whether it gets worse with prolonged sitting or other activities, and noting any other accompanying symptoms, such as urinary changes or blood in the urine, can provide important clues for your healthcare provider. Always take any persistent or unusual discomfort seriously and consult with a medical professional to rule out any serious conditions. Number 5. Pain in the back, hips, or chest. One of the most concerning and insidious aspects of prostate cancer is its ability to spread, or metastasize, to other areas of the body. While prostate cancer usually starts in the prostate gland, it has the potential to move to distant organs, including the bones. When it spreads to the bones, the spine, hips, and ribs are commonly affected. Bone metastasis is often associated with advanced stages of cancer, and the presence of bone pain in these areas can serve as a warning sign that the disease has progressed. Pain caused by bone metastasis is distinct and typically more severe than the usual aches and pains associated with normal muscle strain or overexertion. It is often described as deep, dull, and persistent, and can worsen over time, especially with movement or at night. Unlike muscle soreness that may improve with rest or pain relievers, bone pain from metastasis tends to be more unrelenting and may not respond to typical pain management methods, such as over-the-counter painkillers. The pain is often localized in specific areas, such as the lower back, hips, or chest, but it can also radiate, making it harder to pinpoint. If you experience pain in your back, hips, or chest that doesn't improve with typical treatments, or if the pain intensifies with movement or at night, it's crucial to consult a healthcare professional. These symptoms could indicate that prostate cancer has spread beyond the prostate to other parts of the body, particularly the bones. A thorough evaluation, including imaging tests like X-rays, CT scans, or MRIs, can help doctors determine the cause of the pain and whether metastasis is present. The presence of bone metastasis typically requires more aggressive treatment options, such as chemotherapy, radiation therapy, or medications designed to strengthen the bones and manage the pain. It's important to catch bone metastasis early, as timely intervention can improve pain management and potentially slow the progression of the disease. If you are experiencing these symptoms, don't wait to seek medical advice. Early diagnosis and treatment are key to managing the effects of prostate cancer and maintaining quality of life. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 6. Swelling in the legs or feet. The lymphatic system is an essential part of the body's circulatory system, responsible for maintaining fluid balance, filtering waste, and supporting the immune system. It helps drain excess fluid from tissues and returns it to the bloodstream. When prostate cancer spreads, or metastasizes, to the lymph nodes, it can severely disrupt this delicate balance. The lymph nodes, which act as filters for harmful substances, may become blocked or damaged, preventing the body from draining fluids efficiently. As a result, swelling can occur in the lower parts of the body, particularly the legs or feet. This swelling, known as lymphedema, is not simply a temporary condition caused by standing for long periods or spending a day on your feet. While mild swelling can sometimes be linked to fatigue or fluid retention after a long day, persistent or unexplained swelling in the legs or feet could indicate that cancer has spread and is affecting the lymphatic system. In cases of prostate cancer, swelling in the legs or feet may develop gradually, often without obvious pain but with a noticeable heaviness or tightness in the affected area. This happens when lymph fluid builds up due to a blockage in the lymphatic vessels or nodes, preventing it from being properly filtered and returned to the bloodstream. Over time, this can lead to discomfort, difficulty walking, and changes in the appearance of the skin, such as tightness, shiny texture, or even color changes. If you notice persistent swelling in your legs or feet, especially if it's accompanied by other symptoms such as pain, numbness, or a feeling of fullness in the abdomen, it's important to seek medical attention promptly. Early detection and treatment can help manage the symptoms of lymphedema and address any potential progression of the cancer. Swelling, combined with other warning signs like unexplained weight loss, fatigue, or pain, could point to the advancement of prostate cancer, necessitating further evaluation by a healthcare professional. In some cases, managing swelling may involve compression therapy, physical therapy, or lymphatic drainage techniques to improve fluid circulation and alleviate discomfort. However, it's crucial to understand that the presence of swelling, especially in combination with other prostate cancer symptoms, should not be dismissed as a simple health issue. It could be a vital clue in the early stages of cancer progression, making it important to stay vigilant and consult with your doctor to ensure proper care and treatment. Number 7. Unintentional weight loss. Unintentional weight loss is a common and concerning symptom in individuals with advanced prostate cancer. In the later stages of the disease, cancer cells can significantly alter the body's normal metabolic processes. Prostate cancer cells, like all cancer cells, are highly energy demanding, and they often consume a disproportionate amount of the body's nutrients and calories. This process is known as cachexia, which involves not only the burning of fat but also the depletion of muscle tissue. As a result, your body may begin to lose weight rapidly and without explanation, even when you're not actively dieting or increasing physical activity. This weight loss is a direct consequence of the body's energy imbalance caused by the cancer, rather than any intentional lifestyle change. You may notice a gradual or rapid decrease in body weight, despite maintaining a normal diet and exercise routine. This type of weight loss may be subtle at first, but over time, it becomes more noticeable. People often feel their clothes fit differently or notice that their energy levels are lower than usual, even without making any changes to their daily habits. The weight loss, in combination with other symptoms such as persistent fatigue, pain, or loss of appetite, may signal that the cancer is progressing and affecting the body's overall functioning. This unintentional weight loss is not just about the numbers on the scale. It often reflects a broader issue. The body's ability to maintain proper nutrition and muscle mass is compromised as the cancer consumes more energy and resources. The resulting muscle wasting can contribute to weakness, a reduced ability to perform daily activities, and a general decline in physical health. If you experience unexplained weight loss alongside other symptoms like fatigue, pain, or changes in urination, it's crucial to seek medical attention promptly. Early detection of prostate cancer plays a pivotal role in improving the chances of successful treatment. Catching the disease in its earlier stages can lead to more effective management and potentially better outcomes, as doctors can begin interventions such as targeted treatments or therapies designed to slow cancer progression and address the underlying metabolic changes. By acting quickly, patients may have a better chance of controlling the disease and maintaining a higher quality of life. Number 8. Numbness and weakness in the limbs. When prostate cancer metastasizes to the spine, it can lead to compression of the spinal cord. This compression interferes with normal nerve function and can result in a range of neurological symptoms, including numbness, tingling, and weakness in the limbs. These symptoms occur because the nerves that control movement and sensation in the arms and legs are affected by the pressure on the spinal cord caused by the cancer. In some cases, this may be an indication that the cancer has advanced significantly and is impacting the nervous system. The severity of these symptoms can vary. For some individuals, it may start as mild discomfort or a tingling sensation in the hands or feet, often referred to as pins and needles. However, as the compression worsens, these sensations can intensify, and there may be noticeable weakness in the arms or legs. This weakness can progress to the point where it becomes difficult to perform everyday tasks, such as walking, standing, or holding objects. In severe cases, it may cause total loss of motor function in the affected limbs, leading to a significant decline in mobility. Along with numbness and weakness, there is also the potential for more serious symptoms to develop, such as the loss of bladder or bowel control. This occurs because spinal cord compression can disrupt the nerves that manage these functions, leading to incontinence or difficulty urinating. These symptoms are especially concerning because they suggest that the cancer is affecting the lower spinal cord and can indicate a serious, life-threatening complication known as spinal cord compression. If you or someone you know is experiencing any of these neurological symptoms, it is essential to seek immediate medical attention. Timely intervention can help prevent further damage to the spinal cord and improve the chances of recovery. Medical professionals may use imaging techniques, such as MRI or CT scans, to assess the extent of the cancer's spread and determine the most appropriate course of treatment to address spinal cord compression and its associated symptoms. Prompt diagnosis and intervention are critical to managing the disease and preserving quality of life. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. Are you at risk? Understanding the factors for prostate cancer. Prostate cancer is a significant health concern, and several key factors increase the likelihood of developing this disease, especially in men aged 55 to 85. Understanding these risk factors is essential for taking proactive steps to protect your health. Below are the primary factors that can elevate your risk. 1. Age. As with many types of cancer, age plays a crucial role in prostate cancer risk. The risk of developing prostate cancer significantly increases as you age, particularly after the age of 50. The disease is rare in younger men, but as men age, the likelihood of developing prostate cancer rises, with the majority of cases being diagnosed in men over 65. If you are approaching or over the age of 50, it's especially important to discuss prostate cancer screening options with your healthcare provider. 2. Race. Race is another factor that affects prostate cancer risk. Studies have shown that black men face a higher risk of developing prostate cancer compared to other racial groups. Furthermore, black men are more likely to develop aggressive forms of prostate cancer and tend to experience poorer outcomes. It is crucial for black men, in particular, to be aware of this increased risk and seek regular screenings and early detection strategies. 3. Family history. Family history is a significant indicator of risk. If you have a close relative, such as a father, brother, or son, who has been diagnosed with prostate cancer, your risk of developing the disease is increased. This is particularly true if more than one family member has had prostate cancer or if the diagnosis occurred at a younger age. Inherited gene mutations, such as those in the BRCA1 or BRCA2 genes, can also raise the risk, and this may necessitate more frequent screenings or genetic counseling. 4. Obesity. Obesity is a well-established risk factor for many types of cancer, including prostate cancer. Research has shown that overweight men, especially those with a higher body mass index, BMI, are at greater risk of developing prostate cancer. Additionally, obesity has been linked to more aggressive forms of prostate cancer, which may complicate treatment and worsen outcomes. Maintaining a healthy weight through diet and exercise can be an important part of reducing your overall risk. 5. Dietary factors. While not as directly linked to prostate cancer as other factors, some studies suggest that diet can play a role in prostate cancer risk. A diet high in red meat and high-fat dairy products has been associated with a slightly higher risk of prostate cancer. On the other hand, a diet rich in fruits, vegetables, and healthy fats may help to reduce the risk of developing prostate cancer, as these foods are packed with antioxidants and nutrients that support overall health. Recognizing symptoms and seeking help. If you are experiencing any of the following symptoms: frequent urination, blood in the urine, painful urination, lower back pain, or difficulty getting an erection, these could be warning signs of prostate issues, including prostate cancer. While these symptoms are not always caused by cancer, they should never be ignored. If you fall into any of the high-risk categories listed above, or if you are experiencing these symptoms, it's important to contact your doctor for a thorough evaluation. Early detection is key in managing prostate cancer effectively. When diagnosed early, prostate cancer can often be treated successfully with minimal complications. Regular screenings, including the prostate-specific antigen, PSA, test and digital rectal exams, DRE, can help detect signs of prostate cancer before symptoms even appear. Prostate cancer, a serious but manageable disease. Prostate cancer can be a serious disease, but with the right information, awareness, and early intervention, it is possible to detect it early and improve your chances of successful treatment. Advances in medical research and treatments have dramatically improved the outlook for men diagnosed with prostate cancer, especially if the disease is found in its early stages. Take action now. Your health is worth it. If you found this article informative, don't wait. Take control of your health by scheduling a checkup with your doctor. Discuss any concerns you may have, especially if you fall into any of the high-risk categories outlined above. Early screening, combined with understanding the early warning signs and symptoms, can make a significant difference in your health and well-being. Regular checkups and screenings are essential in ensuring you remain proactive in managing your health, now and in the years to come. Remember, proactive healthcare and early detection can improve your quality of life and increase the likelihood of successful treatment, so don't hesitate to reach out to your doctor today. Now that you've learned about the 8 early signs of prostate cancer, we want to hear from you. What stood out to you the most? Is there a specific sign that you didn't know about before or something that resonated with you? What is one thing you've learned today that you will start paying more attention to or practicing in your own life? Share your thoughts and insights with us in the comments below. We'd love to know how this information has impacted you. Remember, early detection is key, and taking action early can make all the difference in your health. If you found this video helpful and informative, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel so you never miss out on more life-saving information. By subscribing, you're taking an important step towards staying informed and staying healthy. Thank you so much for watching, and we look forward to seeing you in the next video. Stay safe, take care of yourself, and always prioritize your health.